Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about sickle cell disease. So let's get into it. So first of all, sickle cell disease is when the red blood cells of the body are not forming properly. So my little art here. This is my example of a normal, healthy red blood cell. It's round and it's full of oxygen and it's very flexible, which is a good thing. That way it can move through the blood vessels easily. A sickle cell doesn't look like that. It looks more like this, like a crescent moon. So as you can imagine, it has a lot less oxygen carrying capacity than a regular red blood cell. It's also a lot less flexible. They're more rigid and they tend to stick together as they move through the blood vessels. So that can be very dangerous. What I wanted to first point out is all the different types of sickle cell. When you hear that, you probably immediately think sickle cell anemia. And that is what the rest of this video is going to be about, sickle cell anemia. But I wanted to point out the different types because there are a couple. When it comes to the different types, it's all about genetics and inheritance. So HBSS, you get the sickle cell gene, so the S, from each parent. So one from mom, one from dad. These are the children who are more likely to have sickle cell anemia, which is the most severe form of the disease. HBSC, one parent gives the child the sickle cell gene, and the other parent has a different hemoglobin disorder, which is represented by the C. So that's why it's SC. This is a more mild form of sickle cell anemia. HBS, beta thalassemia. So kind of a similar concept as this. You get one sickle cell gene from the parent, and then the other parent gives you beta thalassemia, which is a different anemic disorder. And then HBAS, this is also called sickle cell trait. So a lot of people have sickle cell trait, but they don't have sickle cell anemia. But if a person with sickle cell trait marries another person who has sickle cell trait and they have a child, there is a 25% chance that that child will get sickle cell anemia, so sickle cell disease. So knowing the different types is important because there's not just one, right? We don't just take one patient with one type of illness. You might have a variety of patients that you will take care of that are in the sickle cell disease kind of spectrum. The biggest risk factor for developing sickle cell anemia is having parents who are both sickle cell gene carriers. In the United States, this largely affects the African American population, but can also affect people of Mediterranean and Middle Eastern descent as well. Symptoms usually occur around 6 months of age. So one of the first things is anemia. And that's not just because they're a different shape than the regular red blood cell, it's because there's less of them. They have a shorter life expectancy in the body. So patients who have sickle cell anemia have less red blood cells in general. And some of the red blood cells that they have are damaged, right? Because they're the crescent shape. So that contributes to anemia. Pain. When we don't have oxygen in our body, when we don't have oxygen to our tissues, our body tells us by giving us pain, right? That's a signal. So people who have anemia, sickle cell anemia, have pain. Edema, especially in the hands and the feet. Frequent infections. Delayed growth, especially with these little ones when we start noticing it when they're babies and toddlers, so delayed growth because of that lack of oxygen and nutrients. Vision problems are pretty common as well because of all those tiny little blood vessels in the eye. They can have, blockages in there, so that can cause vision problems. And then hepatomegaly. A lot of people who have sickle cell anemia also have their liver impacted, and gallstones can frequently occur as well because of this. Our biggest concern for our patient with sickle cell anemia is sickle cell crises. So many things can trigger a crisis, and a way you can remember that is sickle. So S standing for significant blood loss. This can occur from a traumatic event or a surgery. I is for illness or infection. C is for continued stress. So this can be like physical stress on the body, but also emotional, mental stress can cause a triggering effect to cause a crisis. This one, I had to be sneaky and get it in here, smoking. So smoking can be a trigger for a crisis. People with sickle cell anemia should never smoke. Nobody should ever smoke, but people with sickle cell anemia definitely should not smoke. L is for low fluid intake, so dehydration. And then E, elevated temperature, like a fever. And then also elevated altitude. So if you are not somebody that normally lives at a higher altitude, and then you go somewhere with a higher altitude where the air is thinner, right? There's less oxygen in the air, your body's not used to it, that can trigger a crisis. I also wanted to point out in relation to the temperature, sometimes just going from a big temperature change. So if you're going from a hot environment to a cold environment, or vice versa, a cold environment to a warmer environment very quickly, that is enough to trigger a crisis in some people. When it comes to our nursing interventions, they are partly focused on preventing a crisis and treating a crisis when it's happening. So things like bed rest, IV fluids, elevating those extremities. We talked about the swelling of the hands and feet, so elevating those. Warm compresses, especially on areas that are painful to the patient. Doing our best to do things to prevent infection. This becomes education about hygiene and like getting vaccines. Pain medications as ordered. I will tell you, as a labor nurse and a surgical nurse, I've seen people in various types of pain. Sickle cell anemia pain is so hard to treat when it comes to pain medications, and I feel so horrible for them. So pain medications, getting those on board right away and doing your best to help those patients experiencing pain. You want strict I&O, daily weights, monitoring their electrolytes. Most people who have sickle cell anemia, it will be recommended that they take a folic acid supplement every single day. Oftentimes, they might be on certain medications to prevent crises. Some of the most popular ones are Hydrea, Endari, and Oxbryta. Your patient might need a blood transfusion. And then last resort here is a bone marrow transplant. A bone marrow transplant is a good thing. It can be very beneficial and helpful to the patient, but there are a lot of risks with it, so we don't do it willy-nilly. We like to do this only for patients who actually are in severe crises and are having a really hard time. Our preference would be to try all of these other things first. This is our last resort, this bone marrow transplant. So that was my video on sickle cell disease, sickle cell anemia. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.